Jason Durel. I'm an otolaryngologist, more commonly known as an ear, nose, and throat surgeon. The best thing about my job is just the ability to make people feel better. And a lot of times in ENT, we're not dealing with the life or death stuff, although we certainly do. And that is extremely rewarding when you save someone's life, but also just someone who's been dealing with allergy problems or sinus problems their whole life. And they come to see us, and we're able to make them just feel better, make sure they can enjoy their days and their nights, and have just a much higher quality of life whenever they walk out. The biggest reluctance that people think that if they come to see an ear, nose, and throat surgeon, the first thing we're going to think about is doing surgery. And the truth is that's the last option. We always do whatever we can to treat a person medically and to avoid surgery at all costs, unless we feel like it's really the only option to make them better. Here in our office, we have our own CAT scan machine, allergy department, audiology department, skincare department. And so we're able to address all of those issues globally, sometimes in one visit and sometimes in multiple, but when they come here, we're going to be able to treat every disorder that they could have in their ear, nose, and throat, or head and neck areas. In a patient that comes to us that has been being treated maybe for years by the primary care doctor for recurrent sinus infections and allergy problems, it means for that patient, depending on what they've had done when they come in, we can get allergy testing that day, a CT scan done that day, and then review some of that material that day or at the next post-op visit or next follow-up visit just in a week or so. And at that point, you have kind of all the information you need to make a good treatment plan, and that's what's really nice. At that point, I lay it out. I have my allergy results for the patient. I have the imaging, which we review with the patient and show them directly exactly what's going on so they understand that. And then we can formulate that treatment plan we were talking about that is directed for that patient towards their goals, and you don't miss anything. You've got a really comprehensive review of the patient's needs.